I was shaving and suddenly my back felt like it was being squeezed really tight, and I just kind of bent over and collapsed on the spot.
Normally, you can only prevent it from getting worse, but it's actually getting better. You mentioned that it was last August, didn't you? When washing your face, you suddenly felt that pain in your back, and you couldn't feel any strength in your legs at all. I believe you were very surprised. Have you had any health issues up until then?
No, none. I was shaving and suddenly my back felt like it was being squeezed really tight, and I just kind of bent over and collapsed on the spot.
So, first you called an ambulance and you went to the hospital, right?
But it seems like they did an MRI of only my head at the time. At that point I could talk and move my hands slightly. But I felt all cold from the waist down and couldn't move at all. It was a national public holiday, so they just checked my head and said there was no immediate danger and sent me home.
You must have been anxious about going home when you couldn't even move your legs. Actually, how bad were your legs?
Couldn't move them at all.
You absolutely couldn't bend or stretch them in any way whatsoever. So you had some tests at the hospital, and it turned out to be an issue with the spinal cord inside the hip bone, specifically the conus medullaris. Is that right? The area around the junction between the thoracic and lumbar vertebrae is usually black, but in your case it turned white like this.
Around where is that?
In terms of location, this is approximately around the fourth lumbar vertebra, therefore 3, 2, 1, 12. Basically, to put it simply, in a manner of speaking, it's like this area deep in the nerves is getting poor blood flow and is getting blocked up, in a way. Both the right and left sides have noticeably changed color, so there was paralysis in both legs. Furthermore, as for this region of the body, it doesn't just control the leg muscles, but also plays a crucial role in the functions of the bladder and rectum. So this means that you are not capable of urinating or have bowel movements, right? In modern medicine, when it comes to spinal cord infarction, we use anticoagulants to prevent recurrence and rehabilitation to prevent muscle weakness and joint stiffness. But there's no fundamental way to heal the nerves themselves. You specifically came to us for treatment of the nerves themselves. When you first came to our medical clinic, your leg muscles were only strong enough to resist a little when pressed lightly, or just barely able to overcome gravity. We did a manual muscle test, and on a scale of 1 to 5, both sides were approximately around 3 to 4 in strength. In that situation, you didn't feel any urge to urinate and had to push to get it out, and there was numbness and sensory issues too, right? Was the numbness pretty intense?
Yes, it was.
Both of your legs were tingling, right? Under such circumstances, when you came to our medical clinic, we initially administered a series of 4 direct spinal injections, and followed that up with 2 sessions of systematic intravenous therapy. In the long run, it's been gradually improving step by step, but how is it after the first session of treatment?
After the first treatment, there was a big change. The numbness was cut in half.
After the first time, how long did it take for you to feel the effects?
About 2 days later.
That's quick. Some people recover muscle strength quickly, but it could take some time for the numbness to improve. But for some, the recovery takes place fast. They start to feel their feet getting warmer, things like that.
Yeah, they felt warmer.
The nerve function is coming back. Do you feel like it's getting a bit easier to put strength into your muscles?
At first I couldn't curl the toes on my right foot, but I could on my left. Then after some time suddenly I was able to do it on the right foot also.
The muscles that help you curl your toes are the flexor hallucis longus and flexor digitorum longus, and I think those muscles are recovering. Did you feel it got easier to support your body or more stable in your core when standing?
Yeah, it got more stable. Before the treatment, I couldn't lean forward without feeling like I was going to fall over.
When you lean in this way, you felt almost like you were going to topple over and needed support. Looking at your sitting posture now, it's really stable, like a perfect seated position. Today, we're doing the 5th direct injection and the 3rd IV injection. Before today's treatment, we did a manual muscle test, and the strength in all the lower limb muscles improved to a 5. A score of 3 means you can move against gravity. A score of 4 means you can handle light resistance. A score of 5 means you can overcome significant resistance, and 5 represents a normal condition. So, the muscle strength in your lower limbs is nearly back to normal. If your numbness was 10 initially, what's the level now?
About a 4, I think.
I see. So that's a 60% reduction from 10 to 4. The tingling sensation can be annoying, even when sitting still. Has that feeling gone away, making things easier?
Yes, much easier.
Sounds good, and I was actually astonished to hear this. But you can squat now, right? You can get into a crouching position. Without lower limb strength and core stability, it's easy to fall over when squatting, but the fact that you can now maintain that position is really surprising. I've been actively involved in spinal treatments myself and conducted numerous surgical procedures over time. However, these surgeries only relieve the pressure on the nerves and can't actually heal the nerves themselves. Especially with spinal cord infarction, there is not much we can do through surgery. Since you came to our clinic and received treatment on your nerves, your nerve function has improved significantly. I think the rehab therapists must have been surprised by this change.
Yes, they were really surprised.
Yes, I suppose they must have been. In most cases, it is only possible to prevent things from getting worse, but in your case, you're actually getting better. Lastly, could you tell us if there's anything in your daily life that's become much easier to do?
Nowadays, basically, I can manage things around the house by myself.
No need for a cane.
I don't use a cane.
It owes to the improvement in your leg strength and core stability. I'm really happy to hear that things are going so well for you.
Thank you.
Please keep us updated on your recovery progress from now on as well.
Thank you very much.